downtown Indianapolis for a special location. Just waiting for everybody to log in. How's everybody doing? All right, let's go ahead and let's set up the Facebook Live session. Okay, just give me 1 second. All right, today we're going to be focusing on next generation of GLP-1 protocols. And we're going to be dealing with GLP-1 protocols, semaglutide, tirzepatide, and then combining them with different peptides. All right, let's just wait a few more minutes for everybody else to come in. All right. Okay, if you guys have any questions, please type the questions here. All right. Okay, we'll get started in about 1 minute. All right. Just see if we can add a little bit of difficulty with the Facebook, but we should be okay. All right, let's see. Okay, I think that's about everybody. So let's go ahead and let's get started. So unfortunately, we're not able to get the Facebook Live, but I think we should be okay. So let's go ahead and let's get started. This will be on YouTube. So if nothing else, you guys can just check it out on YouTube. So the key thing here is, for today, we're going to discuss the next generation of physician-guided weight loss protocols. The important thing about that is those protocols are dictated by you. The key thing to understand here is that we are now going beyond just the traditional protocols that are being offered by the brand name retail pharmacies, the Eli Lillys of the world. What we want to do now is to really create a reconstitution and dosing guide that focuses on optimizing the weight loss for you specifically by balancing the side effects and the symptoms with the weight loss itself. So, what does that mean exactly? And I think that's a key thing to recognize here. A lot of times, when people talk about the side effects and the symptoms of the medications, what they fail to realize is that those side effects and those symptoms are actually feedback mechanisms. they're helping to educate the patient as to how he or she is responding to the medications. For example, constipation. Is constipation really a negative side effect, or is it a signal that helps you understand how your body is responding to the GLP-1 medications? I would argue it's the second. In fact, I often encourage my patients to look at the rate of bowel movements to ascertain how the body is managing fluid levels, because that is a clear indicator of how well a patient is tolerating the GLP-1 medications and whether the patient is due for a dose increase. So let's talk a little bit about these micro increasing in the dosing, because that's critical to helping us understand what we can do to ensure that we are in a position where the medications have the optimal desired effect. So what you should see here right now is a GLP-1 reconstitution and dosing guide. It's a clinical reference for reconstituting and dosing lyophilized semaglutide and tirzepatide with dose escalation schedules, vial strengths, and preparation instructions. The key thing to understand here is that you have both semaglutide and tirzepatide. The semaglutide, being a GLP-1 agonist, has weekly subcutaneous injections for weight management and for type 2 diabetes as well. With the tirzepatide, you have the agonist with weekly subcutaneous injections. So what can we do? Well, the key thing to understand with the semaglutide is that it comes in 3 different strengths when you purchase it here: the 2 milligrams, the 5 milligrams, and the 10 milligrams. With the dosing escalation schedule, as you see here, what you see is with different vial strengths, you can create a different dosing schedule that then results in a more nuanced draw volume. But what that allows you to do is to adjust the vial strength and the vial concentration. So, for example, in this case here, between titration 2 and 3, in one instance you have 0.5, in the other you have 0.68, but the vial strength is 2.5 versus 2, almost 20% more concentrated. Now you have a more concentrated version between 2.5 milligrams per milliliter compared to 2, and a draw volume that's adjustable as well. What that does is allows you to manipulate not just the total quantity of the medication that comes in, but also the concentration of the medicine, which is critical if you're thinking about what you can do to optimize your weight loss and go over weight loss plateaus. For many patients, what I've found is by increasing the vial strength but decreasing the draw volume, you can actually help the body go over the weight loss plateaus by giving a more concentrated version. So this is how I would look at it. You have 2, 2.5, and 5 milligrams per milliliter. And these are the dosing schedules that we offer to our patients at Prestige. What you would do is, in order to get different concentrations, you would then add different degrees of bacteriostatic water. So you don't have now the normal 20, 40, 60, what have you. Instead, you have very specific, nuanced draw volumes. And the reason behind that is you want to have specific levels of concentration for the vials itself. How does that apply to tirzepatide? With tirzepatide, it's the same thing. We offer 5, 10, and 15 milligrams. With each of these, you have different concentrations and different dosing schedules as well. So, for example, with the 5 milligram, you can add 1 milliliter of bacteriostatic water or reconstitute, 1 milliliter reconstitution bacteriostatic water with 10 milligrams, or 1.5. And in each instance, you have a final concentration that's relatively equivalent. But if you were to add just 1 milliliter of bacteriostatic water, you would have 15 milligrams per milliliter, creating a more concentrated dose. And that's critical if you want to now increase the concentration without adding much more of the volume. These factors are critical when you want to create your own customized dose escalation schedule. What you see here is by adjusting the dose and the vial strength, meaning the bacteriostatic water that you reconstitute with, you adjust the draw volume. And by doing so, you can manipulate the concentration of the medicine and as a result get a more nuanced rate of weight loss itself. So for those of you interested in becoming patients at Prestige 2.0, this is something that we can offer for you. It is a customized dosing schedule that is specific for patients interested in customizing their own GLP-1 and GLP-GIP dosing. So if you're interested, give us a call, 219-779-8550, and we'll go from there. Thank you.